HIPAA compliance for behavioral health software comes down to one fact. A single breach can carry fines that bankrupt your organization. HIPAA fines range from $100 to $50,000 per record, and millions of health records are breached every year. Here are the 4 key ways smart software keeps your behavioral health organization in compliance with patient privacy laws. We cover encryption, breach monitoring, patient consent, and staff access control, the 4 protections every operator should expect. Behavioral health records are electronic protected health information, or ePHI, and there are a lot of misconceptions about how to keep it secure. Every record your software stores and transmits is ePHI, and HIPAA holds your organization accountable for protecting it. Most breaches the government labels hacking are actually phishing, attackers simply tricking their employees into revealing their passwords by email. There were 33 reported healthcare data breaches in January 2019 alone, and each violation carries fines that can threaten your organization's survival. 33 reported healthcare data breaches happened in a single month. Improper disposal, theft, and unauthorized disclosure are leading causes. Storing ePHI in an unencrypted format is a HIPAA violation on its own, and it sharply raises your liability if data is ever stolen. At Behave Health, your ePHI gets the same encryption protocol used by federal agencies like the IRS, the NIST Federal Information Processing Standard. Behave Health is designed to encrypt all data in the system using the National Institute of Standards and Technology's Federal Information Processing Standard. If encrypted ePHI is ever stolen, a thief would also have to crack the encryption code to read it, a very tall order. 4 protections decide whether your software keeps you in compliance or leaves you exposed. Let us walk through all 4. Miss any one of these, and you risk a breach, a violation, and fines you can't get back. Protection 1. Encrypt all PHI. Encryption adds a layer of security so that even stolen ePHI stays unreadable without the code used to encrypt it. Storing ePHI in an unencrypted format is a big HIPAA no-no, and Behave Health is designed to encrypt all data in the system. Protection 2. Stay on guard against breaches. Behave Health software is designed to scan for anomalous activity and automatically identify and block intrusion attempts. Virtual file systems are designed to be scanned for integrity, malware, and rootkits, with rapid patching as new vulnerabilities are published. Protection 3. Keep patients in control of their data. Behave Health is designed to build patient consent forms for the use of PHI directly into the intake workflow, so permission is captured automatically. Records are designed to be stored in accordance with applicable federal and state retention requirements, keeping patients in control. Protection 4. Control the level of staff access. A newly hired counselor doesn't need the same access to PHI as a veteran clinical supervisor, and your software should reflect that. Behave Health is designed to give each user a unique account governed by custom permissions, so you decide who can access what and when. Knowing how breaches actually happen is how you prevent them. These are the leading causes named in the data. Most incidents the government labels hacking are really phishing, attackers tricking employees into revealing their passwords by email. Improper disposal of data is a leading cause of healthcare breaches, alongside outright theft. Unauthorized disclosure of PHI remains a leading cause of HIPAA violations, which is why staff access control matters. Behave Health is designed to bring encryption, breach monitoring, consent, and access control together, so compliance is built into the daily workflow. All data in the system is designed to be encrypted with the same Federal Information Processing Standard used by agencies like the IRS. The platform is designed to continuously scan for anomalous activity and block intrusion attempts before they become breaches. Custom, role-based permissions on every unique user account are designed to prevent the unauthorized disclosure that drives HIPAA violations. Stop risking bankrupting fines on every record. Book a 20-minute demo with HIPAA-ready behavioral health software at behavehealth.com. See encryption, breach monitoring, consent workflows, and role-based access built for behavioral health at behavehealth.com.